cards you all have.
They don't, it's not government medicine what they get. I get what they get. My husband works for the Veterans Administration. They have private insurance. They have Blue Cross Blue Shield federal employee plan paid for by the government.
Paid for by the government.
But it's not government. It's not like Medicare or the Veterans. Veterans is socialized medicine. My husband is salaried by the government. He works for the government. He's not paid per patient or anything like that.
And the doctors work directly for the government in that sense.
Yes.
So it's
that's
fully socialized.
Fully socialized medicine.
Okay.
But the legislators are federal employees, and they get paid they get covered like other federal employees do, which is private, really. The government's paying the bill, but it's privately.
Yeah, well, that's why the government's paying the bill. Wow.
Well, I mean, they have very good insurance, as do I, because of their job, but it's not, it's not socialized medicine. The Army is socialized medicine, and the VA and the Indian Health Service is socialized medicine. And Medicare is not socialized medicine. It's privately delivered, but paid for by the government. As a physician, I accept Medicare, but I am not salaried by them. I am in my own private office.
Do you accept Visa and MasterCard as well? So explain that. So you are, under single payer, you would remain a completely private practice. The government couldn't tell you how to treat your patients, is that correct?
Well, the health insurance companies can't tell me how to treat my patients. They only can tell me what they'll pay.
Okay.
So nobody's telling me how to treat my patients. They're telling me how much they're going to pay for it. But it's true. We have single payer in this country. It's been working for 44 years. It's Medicare. That's what we want for everybody. It would be so easy. Lower the age of Medicare by 10 years every 5 years. Before you know it, we'd all be covered. And, when Obama says it would be so disruptive, well, who is it going to be disruptive to? They're all going to lose their jobs.
Medical industrial complex.
Right, that's who it's going to be. That's who it's going to be disruptive to. It's not going to be disruptive to everybody else. So it's not, we have single payer here. It's not a new concept. It's not, a radical, transformation. 60% of the healthcare costs of this country are already being paid for by the government, because that includes Medicare, Medicaid, the veterans, the Army, and the Indian. So that's already 60% of the bill.
Okay. Now, and do the higher cost people to insure, they end up in the public sector. There are two tiers of healthcare, correct?
That's what happened. That's what we're afraid would happen with the public option. The private insurance companies would continue to cherry-pick the healthy people, and then, that's why Medicare got passed. Well, who wants to take care of old people? They cost a lot of money, so let the government do it.
Okay.
Who wants to take care of poor people? They cost a lot of money, let the government do it. So that's what would happen. They would still be cherry-picking the healthy people, and the only way you can bring the cost down is have the risk pools be huge, so that the healthy people are subsidizing the sick people.
Any questions? Any more questions? Yes, go ahead. Your name?
My name is Amy, and can you hear me, or should I talk into the machine?
Oh, here.
Here, give it to them.
There you go.
It's two questions. One is practical things people can do now that lose their jobs. The other is that the only occasion where people really are murderous toward others, like deny them medical care, is when their lives are threatened. That's when people become murderous. And in Europe they have one person, one vote. They have ballot access. They have income support. So if you're in the insurance business, you're in a democracy, unlike here. You won't lose your house, your medicine, your food, your education if you lose your job. Here you will, because we don't have democracy. So how can we even hope for anything given the Electoral College lack of runoff elections, which even Afghanistan has? Put the mic closer to your mouth. Oh, right here, sorry. I'm saying without one man, one vote in this country with the Electoral College, how can we possibly hope for anything sane, given that without a job, these insurance executives are going to starve and die, or so they think. In Europe, they still have their house and their medicine, and they wouldn't have to, kill people to stay alive. So that's my question.
Okay.